Hey, I'm Dr. Perry from Farmington Family Dental. I get a lot of questions about dental bridges, so I figured I'd sit down for a minute and answer some of the most common questions I get. Sometimes people ask, what is a dental bridge? A dental bridge is one of several ways we have in dentistry to replace a missing tooth. So say you had an accident or something rotted out, you lose a tooth, and you need to replace it. So when we put in a dental bridge, it hooks onto the tooth behind and the tooth in front to hold on to the two to hang a tooth that doesn't have a root on it. And it looks kind of like a bridge, like that little plank that you used to lay on top of the canal to cross the canal when you were a kid. Oh, there are some big differences between a bridge and dentures. Fundamentally, the difference is a bridge doesn't come in and out. It's glued on to the teeth that hold it, like a crown is. You don't see it, you don't really even notice it for being fake. A denture or something like that comes in and out. They're okay to chew with, they're okay, but that's about all I can say. Dental bridges have pros and they have cons. So let's talk about the pluses and we'll talk about the cons afterwards. So on the good side of things, it doesn't come in and out. That's probably the number one thing. And in certain cases, it can be the best looking thing, if you're looking for aesthetics and the beauty of the smile, that we can deliver for restoring that. On the con side, there's maintenance with it. And when they tend to fail, everything in dentistry has a lifespan. When that lifespan expires, it usually means we're replacing the bridge. There are some other maintenance issues that you can have that can be relatively minor, but I think those are some of the big downsides on bridges. Okay, so there are different types of even dental bridges. The types just usually vary on how long are they, how big are they, and what materials are they made of. Let me talk about the length side first. So a dental bridge can be anywhere from like 3 or 2 even sometimes, all the way up to 16 teeth long. And the length really just depends on where you need it to function. Whatever space you need it to fill, that's what you do. As far as the materials, you can make them out of gold. You know, back in the day when gangsters used to have their grill, like that's a bridge. All the way down to something that's made out of porcelain. It's just a white colored material. Doesn't have any metal showing in it. For a lot of the people that come to the office, I see a lot of 50 or 60-year-olds that come in with a tooth that looks almost dead, like it looks gray or dark up top where you see that metal band. That technology is what's called a PFM, or porcelain fused to metal. Oftentimes people tell me, hey, can I replace these? Yeah, you can replace them with a full porcelain that will look a little bit more lifelike. Okay, so the benefits of a dental bridge. Having a tooth. If you've ever lost a tooth, it can be an emotional or traumatic experience even, especially if it's one of the ones in the front. Just having a tooth there is a big deal. In the back, sometimes people tell me, well, gosh darn, is there any benefit in the back of replacing those? I mean, they're back teeth, you can't see them. But the answer is yes. You know, when we lose back teeth, we will lose the front teeth after that, because if you don't have back ones to chew with, you're going to be chewing on the front ones, and you will destroy those before too long. So you need something in there that's solid that you can close down on. Otherwise, we're going to lose front ones as well. But they replace teeth and they work great. So sometimes people ask me, does it hurt? Pain is like a major concern when people come in and get dental work done. On a bridge, painless. You're not going to feel anything beyond the shot. Sometimes you'll feel the anesthetic, especially if it's one of the lower ones or one of the front ones on the top. After that, pain-free, we'll be able to get it done. And in a lot of cases at our office, we do it same day. So there, from start to finish, we have that bridge done, and we have it in your mouth that day or very, very soon after, because we fabricate them in-house. The lifespan of a dental bridge. So people sometimes ask me that. How long is this thing going to last? The average that I see from literature is anywhere from 15 to 20 years. Now, there are a lot of things that change that, by the way. The most significant thing is, what did we start with before we put the bridge on, and how did you take care of it while it was in your mouth? With proper home care, it will, of course, extend the life of things, and with a good, ideal situation, it's going to be much longer. The oldest one that I've seen was 63 years old. Somebody was about 70 or 80 years old in the practice, and they had it when they were a kid. Still in there, working great. I've seen them last that long. I've also seen the flip side of things where they don't. And a couple years down the road, something breaks or the tooth underneath it fails. And that comes down to what do you have to work with before you even start. The better the situation, the better off, the longer it's going to last. But literature says 15, 20 years is fairly typical. Okay, so on the subject of caring for your dental bridge, how do I take care of this thing? I went through the work, I put it in, how do I take care of it? The most important thing is flossing underneath the bridge. There are different designs we make for how that fake tooth hangs, and ones where it's high and dry and clean and away from the gums are a little bit easier to clean and maintain, but you'll need to slip a special type of floss underneath there and floss underneath that bridge so you can get in between those two teeth that are holding it. So you're considering getting a dental bridge or you already have one. How do you maintain this bridge? Okay, so the most important thing for you to do is floss underneath it. So you'll notice that fake tooth, it's either pressing right up against the gums or it has a little bit of spacing, but you'll have to floss. You need to floss a little flosser in between underneath that bridge. Now, second thing you should know, it's critical with any dental work or even without dental work, come in to see the hygienists. Do that every 6 months or more frequently if you need it. And we'll tell you if you need it. But having that in your back pocket allows you to catch things if there is an issue, you get it while it's small. That really prolongs the lifespan of work that's done and your natural teeth. Okay, so when should you schedule? Just give us a call. Farmington Family Dental, we'd love to see you. 573 756 5760. Anytime, give me a call. We'll get you taken care of. Okay, so I hope I answered some of your questions about dental bridges. And if you have any additional questions or you're ready to move forward on it, give us a call at Farmington Family Dental. That's 573 756 5760. It was great seeing you today.